Labeling psychological disorders. The biopsychology of mental disorders. So modern biopsychology assumes that some mental disturbances involve the brain or nervous system in some way. So remember when we talked about the different approaches, we're talking about the biological approach now. Subtle changes in the brain's tissue or its chemical messengers, the neurotransmitters, can profoundly alter thoughts and behaviors. Genetic factors, brain injury, infection, and learning are all some of the factors that can tip the balance towards psychopathology. So we've talked about how the different perspectives or approaches, they approach different problems. So this is the biological perspective. So when we look at mental disorders, we're talking about chemical imbalances, brain injuries, genetics, how you could inherit those traits. So indicators of abnormality. While psychologists look for three classical symptoms, not all disorders have such severe symptoms. A few others are these. So if you remember from the intro, PowerPoint, we looked at the three like main things that, that are in mental disorders, but there are other ones as well. And when we look at that, when a doctor's trying to diagnose someone, they're looking for the main ones, but they're looking for these other symptoms as well, and how many of them are present and how severe they are when they're looking to diagnose someone. So some of the other ones are distress. Does the individual show unusual or prolonged levels of anxiety? Maladaptiveness. Does the person act in ways that make others fearful? Irrationality. Does the person act or talk in ways that are irrational or incomprehensible to others? Unpredictability. Does the individual behave erratically and inconsistently at different times? Unconventional or undesirable behavior. Does the person act in ways that are statistically rare and violate social norms? So if you look throughout these, hopefully, what comes to mind is maybe some cultures this could differ, right? Especially the last one where it says social norms. Well, what could be a social norm for one society might not be a social norm for another society. So a lot of these are culturally based a little bit. And so even if you go through them like distress, irrational, unpredictable, a lot of these are, we're looking at social norms and are you violating those social norms? And so think, people maybe, maybe it's in person, maybe it's just on a TV show, and people who have mental disorders. And look, are they showing any of these symptoms? So a lot of students mentioned that they've seen people act like this, like homeless. And a huge percentage of the homeless population actually have a mental disorder. I believe I've mentioned it earlier in the year, but the homeless population went up when they actually started closing down mental institutions. And we'll get into this. And it has to do with the increase of medications. So with the increase of medications, that led to closing down of mental hospitals. Well, if people don't take their medications all the time, their symptoms come back. They can't hold down a job, and then you see the homeless population increase. The more, the better. So I was kind of mentioning this earlier. Clinicians are more confident in labeling behavior as abnormal when two or more of the indicators are present. So extremes or prevalence equals greater confidence in diagnosis. So sometimes these, are very hard to diagnose, especially if they're not severe. Obviously, the more severe and the more different symptoms you have, the easier it is to diagnose. But a lot of times people are misdiagnosed or not diagnosed at all, which would be a misdiagnosis. The DSM-5. So the DSM-5, the American Psychological Association, developed the most widely used classification system for psychological disorders. The book is called The Diagnostic and Statistical Manual of Mental Disorders. And so the newest one that came out in the May of 2013 is the fifth edition. And actually, there's been more than 5 editions because there's been, like the last one was the DSM-4 TR, which was a text revision of the fourth edition. So, and this is the main one in America. There are other ones that are used internationally, but this is the main one that we focus on. And this is used internationally as well, but there is another one that some countries use. Experiment in a mental hospital. A young psychologist, David Rosenhan, set up an experiment to see if mental hospitals could really detect someone with mental illness. He felt that terms like sanity, insanity, schizophrenia, mental illness, and abnormal might have fuzzier boundaries and more fluid definitions than those in the medical world were giving them credit for. So in the medical world, especially at this time, it was more black and white. You have this, you don't have this. He was saying, there's like a gray area. What is sanity? What is insanity? Kind of how I mentioned earlier with like cultures. Like one culture might consider you insane, another culture might not. Especially when we talk about schizophrenia, like hearing and seeing voices. Some cultures, might think you're crazy. Another culture might, see you as the as someone like a head person because you have connections to spirits and things like that. So cultures definitely, depend on how you look at it. So it's not black and white. It's more of a gray area. And almost kind of like the spectrum we talked about before. It's not just, oh, you have this or you don't. Usually you fall somewhere on the spectrum. So Rosenhan's experiment. Rosenhan also suspected that some strange behavior seen in mental patients might originate in the abnormal atmosphere of mental hospitals rather than in the patients themselves. So to test these theories, Rosenhan and 7 colleagues conducted the Rosenhan experiment in the early 1970s. And this is the case. When we talked about the history of like mental hospitals, a lot of times if you weren't sick going in, you were sick coming out because how they like restrained you, kept you locked up with no sunlight and things like that. So, the atmosphere you were in did not help you at all. In fact, even if you weren't, quote unquote crazy beforehand, you would be afterwards. So he does his experiment. And so in this experiment, he said that the mistaken diagnosis were most likely a result of the lack of time that doctors spent with patients. So surprisingly, the other hospital patients readily detected the experiment. The pseudo patients reported that the other patients regularly voiced their suspicions. So what his experiment actually did. So these were the results. So what his experiment did. So him and 7 colleagues, he had 7 people, psychologists, go into a mental hospital and say they had schizophrenia. And the doctors diagnosed them with schizophrenia. They went in there, and everyone, the doctors thought they had schizophrenia, but the patients were like, hold on, there's nothing wrong with you. So the doctors couldn't tell that they were lying, but the patients could tell that they were lying. Which just shows how people are misdiagnosed all the time. So after the experiment, all the people who served in the original study were eventually discharged from the hospital with the label of schizophrenic in remission. So to put it another way, they were still considered schizophrenic, but they were temporarily free of symptoms. So the doctors wouldn't even admit that they were wrong. They just said, oh, you had schizophrenia, but you don't anymore, right? Just because they diagnosed them. Which I still think is interesting how the patients, right, who are considered insane, but yet they were able to figure out and not the doctors. All right, so the last slide. Labeling psychological disorders. So a couple of vocab words now. Psychosis is a symptom or feature of mental illness typically characterized by radical changes in personality, impaired functioning, and a distorted or non-existent sense of objective reality. Neurosis, characterized by excessive anxiety or insecurity, compensated for by various defense mechanisms and lacking evidence of neurological or other organic disease. Insanity, to those mental illnesses that are of such a serious or debilitating nature as to interfere with one's capability of functioning within the legal limits of society and performing the normal activities of daily living.